The Washington State Department of Health is reporting a rise in the Delta variant, which originated in India.
Elise Haas shows us who's still at risk for serious illness there.
The Washington Department of Health tells me that the people who are most at risk for these variants of concern that are circulating, like the Delta variant, are people who are in that older age group, 65 and up. And they also say that nearly 20% of that older population still hasn't gotten vaccinated yet. So they say that the best way to protect yourself and protect others who can't get vaccinated for, say, medical reasons, or people who are ineligible, like kids, is to get your shot. The Department of Health assures me that they're doing everything that they can to reach these people and encourage them to get vaccinated in Washington. But in the meantime, the Washington state health officials are recommending that people who aren't vaccinated use the second best method of protecting themselves by wearing a mask, washing their hands, and keeping distance from others. If you are not fully vaccinated in Washington, the Department of Health says that you need to continue wearing a mask in public, indoor settings like grocery stores, libraries, and movie theaters. In order to track these variants of concern that are spreading, Governor Jay Inslee's office and the Secretary of Health closely monitor surveillance reports on a daily basis. They work with several research centers to develop modeling situation reports every other week. And in their last report that they just published yesterday, their data shows the Delta variant has increased in Washington to evidence of 656 cases. That's up from 402 cases the week before. And with more contagious variants of the virus that are going around in Washington, in Oregon, across the country, and around the world, the Washington Department of Health says that people who are unvaccinated should really avoid travel at this time. Elise Haas, KOIN 6 News.